Welcome to our video on 10 incredible remedies for swollen ankles and feet. Our goal in this video is to help you find relief from the discomfort and pain caused by swollen ankles and feet through various natural remedies. Swollen ankles and feet can be a real nuisance affecting your daily life significantly. The swelling, also known as edema, not only causes discomfort, but can also make it difficult for you to move around or even wear shoes properly. Imagine feeling like your feet are trapped inside tight balloons that are constantly being inflated. The pressure builds up, making every step feel like a challenge. This problem may lead to feelings of frustration, embarrassment, and even depression due to its impact on your overall mobility. The swelling in your ankles and feet occurs when excess fluid accumulates in the tissues of these areas. Several factors can contribute to this issue, such as standing or sitting for long periods of time, pregnancy, obesity, injury, or trauma, like sprains. Certain medications, such as those used for blood pressure regulation, or underlying medical conditions like kidney disease, in some cases swollen ankles and feet, could be a sign of more severe health issues such as heart failure or deep vein thrombosis. Now here's an interesting fact that might surprise you. Did you know that gravity plays a role in causing swollen ankles and feet? When we stand or sit upright for extended periods without moving, much gravity pulls fluids down towards our lower extremities. This makes it harder for our circulatory system to pump the fluids back up towards our heart, efficiently leading them to pool up in our legs, resulting in swelling. So next time you're stuck at work sitting behind a desk all day, remember how important it is. Take breaks regularly so that you keep moving. In this video, we will delve into 10 incredible remedies which will provide relief from swollen ankles and feet, while addressing their root causes too. Stay tuned, because these solutions might just change your life for the better. But before we dive in, can you do us a favor and like this video, ring the bell for future notifications, and make sure you subscribe to Healthy Natural Remedies for more natural health information. Now let's start our countdown at number Stay Hydrated 10. Stay hydrated. Did you know that keeping yourself well hydrated can do wonders for reducing swelling in your feet and ankles? It's true, in fact. Dehydration can cause the blood in our bodies to become thicker and more difficult to circulate, which can lead to fluid retention in the lower extremities. But fear not, as staying hydrated can help keep the blood thin and flowing freely. Research has shown that proper hydration is crucial in preventing swelling and discomfort in the feet and ankles. One study found that increasing water intake resulted in a significant reduction in swelling in patients with lymphedema, a condition characterized by swelling in the arms and legs. Another study found that dehydration was a major risk factor for venous insufficiency, a condition that can lead to swelling, pain, and varicose veins in the legs. But it's not just water that can help maintain proper hydration levels in the body. Herbal tea and coconut water are also great options. However, it's important to avoid beverages with a diuretic effect, such as alcohol and caffeine, as these can actually lead to dehydration. If you have a history of swelling in your feet and ankles, making it a goal to consume at least 8 glasses of water every day can be helpful. It's also important to consume water in small amounts frequently throughout the day to prevent dehydration. And staying hydrated isn't just important for reducing swelling. Adequate water intake is essential for promoting overall health and well-being, from maintaining healthy skin to bolstering the immune system. There are countless benefits to staying hydrated, so make it a priority to keep yourself well hydrated, and your feet and ankles will thank you. Number 9. Reduce salt intake. Reduce salt intake. Your salt intake can work wonders in reducing the edema that occurs in the feet and ankles. Salt causes the body to retain water, which can lead to bloating and swelling. By cutting down on salt in your diet, you can minimize the amount of water your body retains and thus reduce the amount of edema in your lower extremities. According to the American Heart Association, the recommended daily sodium intake for individuals is no more than 200-300 milligrams, equivalent to approximately 1 teaspoon of salt. However, the average American consumes about 300-400 milligrams of sodium daily, far exceeding the recommended limit. This excessive salt intake can contribute to various health problems, including high blood pressure, heart disease, and stroke. Interestingly, reducing sodium intake might also improve the flavor of the food you eat. When we consume too much salt, our taste buds become less sensitive to it, which means we need to use more salt to achieve the same level of flavor by reducing our salt intake. We can retrain our taste buds to appreciate the natural flavors of food making. Healthy eating a more enjoyable experience. Cutting down on salt in your diet can be challenging as it is present in many different foods. However, there are numerous ways to reduce salt intake, such as cooking with herbs and spices rather than salt, and reading food labels to identify products high in sodium. By minimizing the amount of salt you consume, you can improve your overall health and reduce swelling in your feet and ankles. Studies have also shown that reducing sodium intake can be beneficial in reducing edema. One study found that restricting sodium intake led to a significant reduction in edema in patients with heart failure. Another study found that reducing sodium intake decreased the incidence of leg swelling in patients with chronic kidney disease by reducing your salt intake. You can not only reduce the edema in your feet and ankles, but also improve your overall health and prevent the onset of various health issues. Start reading food labels and experimenting with new spices and herbs to enhance the natural flavors of your meals. Number 8. Get enough magnesium. Magnesium is a crucial mineral that plays a significant role in reducing edema in the legs and feet. A deficiency in magnesium can contribute to fluid retention and swelling, which is one of the body's symptoms of magnesium deficiency. Magnesium plays an essential role in regulating fluid balance in the body. Studies have shown that increasing magnesium intake can help reduce edema. One study found that magnesium supplementation decreased edema in pregnant women, while another study found that magnesium supplementation improved lymphedema symptoms in breast cancer survivors. If you're looking to increase your magnesium intake, incorporating foods like spinach, almonds, cashews, avocados, broccoli, and dark chocolate into your diet can be helpful. These foods are all good sources of magnesium and can help prevent magnesium deficiency and reduce swelling. In addition to dietary sources, Epsom salt baths can also be an effective method for increasing magnesium levels and reducing swelling. Epsom salt is a type of magnesium sulfate that, when added to warm water in the form of a foot bath, can help relieve sore, swollen, and fatigued feet. Because magnesium is absorbed through the skin, the magnesium in the Epsom salt helps to relax muscles and reduce inflammation. Incorporating magnesium-rich foods and Epsom salt baths into your routine can be an effective way to reduce edema and promote overall health. However, it's important to talk to your doctor before starting any new supplement or treatment, especially if you have underlying health conditions. Elevate your legs. Number 7. Elevate your legs. Elevating your legs is a simple and effective way to reduce swelling in your feet and ankles. Prolonged sitting or standing can cause fluid to accumulate in the lower extremities, due to the effects of gravity leading to swelling. By elevating your legs above your heart, you can encourage excess fluid to flow back towards the heart, promoting blood flow and reducing swelling. Not only can elevating your legs reduce swelling, but it can also help lower the risk of complications such as deep vein thrombosis and blood clots. To elevate your legs, you can either sit or lie down and use a pillow or cushion to prop your feet up. The higher the feet are elevated from their normal position, the more effective this strategy will be. However, it's important to maintain a slight bend in your knees to allow for proper blood circulation through the veins and arteries in the knees. According to Dr. Sanjeev Lakhanpal of the Center for Vascular Medicine, bending the knees ever so slightly allows more room for blood to circulate, which is extremely beneficial. Therefore, with a slight bend in the knee, your ankles should be above your knees. Elevating your legs can be done multiple times throughout the day, and it's a safe and effective method for reducing swelling in the feet and ankles. However, it's important to consult a healthcare professional if you have any underlying medical conditions that may prevent you from keeping your legs elevated for long periods of time, as doing so may cause fluid to build up in other parts of the body and be dangerous. By incorporating these simple strategies into your daily routine, you can improve your overall health and reduce swelling in your lower extremities. Wear compression socks or stocking. Number 6. Wear compression socks or stockings.